So first off, what is the House Tree Person Test? The House Tree Person Test, also known as the HTP, is a projective test intended to measure different aspects of personality. Test takers are asked to draw a house, a tree, and a person, and the interpretation of these drawings is used to create a picture of a person's cognitive, emotional, and social functioning. Qualitative scoring, on the other hand, is a subjective analysis of a drawing meant to measure the test taker's personality. This type of scoring of the House Person Tree test is highly personal and can vary from one analyst to another. Similarly to the scoring of the qualitative tests, there's limited empirical evidence to support its validity. And before we get into this, I wanted to let you know that this video is actually sponsored by Skillshare, my favorite online learning platform, but I'll talk about 1948. Based on the Draw a Man personality test, created by Florence Goodenough in 1926, it was originally designed to assess children's intelligence. Buck further updated the House Tree Person test, together with the psychologist Emanuel Hammer in 1969. The House Tree Person test is one of the most widely used projective tests for children and adults and is suitable for any individuals aged 3 and older. You should also know the test is actually used by clinical psychologists, occupational therapists, and teachers. It is also employed as part of a series of personality and intelligence tests, including the Rorschach, Thematic Apperception Test, and the WAIS, as means of a personality overall assessment. What's more, the House Tree Person test is an effective tool in evaluating brain damage in patients with schizophrenia. So let's go over the technicals of it. The House Tree Person test takes on average 150 minutes to complete. Therapists can choose between a one-phase test, where a pencil or crayon is used for each drawing, and a two-phase test that uses a crayon in the first phase and a pencil in the second. Each phase has two parts, where the first, nonverbal and creative step is followed by the structured verbal one. So for instance, test takers are instructed to draw a house, and then a tree, and then a person as accurately as possible on separate sheets of paper. They are then asked a number of questions about their drawings. And Buck proposed a list of 60 questions. However, trained test givers are free to create their own variations and ask different questions. So here are some of the examples of the questions that might be asked. For the house, who lives in the house? Do people visit the house? Is it a happy house? What is the house made of, and what goes on inside of the house? Here are some questions for the tree image. What kind of tree is it? How old is the tree? What season did you draw this tree in? Is the tree alive? And who waters the tree? And lastly, probably the most important, here are some questions you can ask about the person. Who is the person? How old is the person? How does that person feel? And are they happy? And what is the person like doing? Now, after the respondents have answered these questions, their drawings are analyzed and interpreted. Now, the interpretation is probably the most important part. The House Tree Person test is based on the idea that drawings reflect feelings. The details of a drawing are seen as representations of various personality traits. So let's go over some of these interpretations. Drawing a house. The house is considered to be the expression of the respondent's family relations and family values. The roof stands for the intellectual side of the spiritual life of the individual. The walls might be related to the test taker's character strength. And the doors and windows represent the individual's relationship to the outside world and the level of social integration. Next, we have the tree. The tree is thought to suggest the deepest unconscious aspects of their personality. The branches may show the degree of social connectedness. For example, a tree with no branches indicates that the person has little contact with others. The trunk is often seen as a representation of inner strength, and the tree crown stands for ideas, thoughts, and self-concept. Lastly, we have drawing a person. The person is a symbolic representation of the ideal self and one's social interactions. For example, the head symbolizes intelligence, communication, and imagination. The eyes indicate the perception of the world. The hands give information about affectivity and aggressiveness. And even though these are a lot of different aspects, there are several other aspects of drawing that therapists may take into account when analyzing House Tree Person tests. I'm going to go over some of those now. Number 1, dimension of objects. The dimension of objects in a drawing are thought to indicate the level of self-esteem and confidence. For example, a very small house might show that the individual's dissatisfaction with life at home. Next, we have level of detail. The level of detail is another revealing factor in outlining the respondent's personality through drawing. A very detailed face might indicate a need to present oneself in a favorable social light. On the contrary, pictures lacking detail often indicate depression. Number 3, we have the location of objects. The location of objects on the page is also charged with significance. Drawings close to the top of the page are considered being related to dreams and imagination, while the ones at the bottom are connected to the physical world. Drawings on the right side of the page are linked to the future, the center are related to the present, and the left to the past. Fourth, we have strokes and lines. For example, the pressure, firmness, and solidity of strokes and lines indicate determinedness, determination, and decision-making faculties. The same line drawn twice sometimes shows insecurity, dissatisfaction, or perfectionism. Emotional strength, high self-esteem, and confidence, on the contrary, are usually reflected in the firmness of the lines. Lastly, we have the test taker's attitude. In addition to all of the above elements, therapists also consider the test taker's attitudes, their words, and their gestures while drawing. Any display of frustration, anger, or satisfaction is taken into account in the test analysis. Now, even though this is a test, you may be wondering how it is scored. Well, a house tree person test can be scored either in an objective, quantitative, or subjective, qualitative manner. Trained therapists rely on John Buck's comprehensive 350-page manual and interpretive guide in administering and scoring the house tree person tests. And if you're wanting to learn more about the house tree person test, you may be wanting to learn a bit more about yourself or healthier ways to deal with something.
Okay, so yesterday with this one, draw person now, it was house person test, right? So we discussed that it was developed by John Buck and comprises of 60 questions to ask the respondent. The test interpreter can also add some of his questions during the test. In this HTP, the candidate is said to draw a picture of a house, tree, and a person. After completion of the drawing, the examiner asks a few questions to the respondent and then analyzes the answer. Right? So, a few questions which we have already done. So, a projective test is a personality test designed to let a person respond to ambiguous stimuli, presumably revealing hidden emotions and internal conflicts projected by the person into the test. The goal of such test is to uncover hidden conflicts or emotion that you project onto the test with the hope that these issues can then be addressed through psychotherapy or other appropriate treatments, right? So projective test emerged from the psychoanalytic school of thought, which suggested that people have unconscious thoughts or urges. By interpreting responses to ambiguous cues, psychoanalysts hope to uncover unconscious feelings that might be causing problem in a person's life, right? So how this test work? We have done few. So in many projective tests, people are shown ambiguous image and then asked to give the first response that comes to the mind. The key to projective test is the ambiguity of the stimuli. According to the theory behind such test, using clearly defined questions can result in answers that are carefully crafted by the conscious mind. Right? When you ask a straightforward question about a particular topic, you have to respond, you have to spend time consciously creating an answer, right? So time is there, then the conscious mind will reply. This can introduce bias and even untruth, right? So through these projective tests, what is actually the purpose that unconsciously you are replying, right? So all those are the unconscious, right? Whether or not you're trying to deceive the test provider. For example, a respondent might give answers that are perceived as more socially acceptable or desirable, but are perhaps not the most accurate reflection of their true feelings or behavior. So by providing you with a question or stimuli that is not clear, your underlying and unconscious motivations or attitudes are revealed. Fine. So if we don't know that what exactly, right, is the meaning of that house, that tree, the person, right? So definitely we'll be doing it unconsciously. The hope is that because of the ambiguous nature of the questions, people might be less able to rely on possible hints about what they think the tester expects to see. So as a result, they are hopefully less tempted to fake good or make themselves look good as a result. Right. So this one we have done, the Rashad Singh blot in right? So it was one of the first projective tests developed and continues to be one of the best known and widely used, right? So it's psychiatrist Harvin in 1921. And they were like 10 cards that depicts an ambiguous ink blot. People are shown one card at a time and asked to describe what they see in the image. The responses are recorded, right? And gestures, the tone of voice, and the reaction are also noted. The result of the test can vary depending on which of the many existing scoring system the examiner is using, right? So we have also seen the various ink blots, right? And it's also giving us that what usually, right? So we have also seen the percentages, and this one is popular responses for bat, butterfly, moth, popular responses to human face, right? Four-legged animal, dog, elephant, bear, then popular response to humans, human figures, then popular response, animal hide, skin, rug, popular response, bat, butterfly, moth. And here, animal hide, skin or rug, and this one is human head of faces. Animal, not dog or cat, four-legged animal. Human, crab, lobster, spider, rabbit, head, caterpillars, worms, snakes, right? So we did this one yesterday. So this is a thematic apperception test, right? Here, people are asked to look at a series of ambiguous scenes and then to tell a story describing the scene. This includes describing what is happening, how the characters are feeling, how the story will end. The examiner then scores the test based on the needs, motivation, and anxieties of the main character, as well as how the story eventually turns out. The test taker draws a person and the image that is created is then assessed by the examiner. To score the test interpreter might look at a number of factors. These may include the size of the particular parts of the body, the features, right, the level of detail given to the figure, as well as the overall shape of the drawing. So like other projective tests, the draw a person test has been criticized for its lack of validity. A test interpreter might suggest that certain aspects of the drawing are indicative of a particular psychological tendencies. However, it might simply mean that the individual has poor drawing skill. I think we have discussed this before. The test has been used as a measure of intelligence in children, but research comparing scores on the preschool, and primary scale of intelligence to draw a person test found a very low correlation between the two tests. Okay, and is the same that designed by John Buck includes 60 questions. All right, now from this image, what all can we interpret? Closed, closed. It's cylinder and
It's a winter season,
mm,
unhappy tree or unhappy person.
and we can see the fingers as well, I guess. These are the fingers.
And there are no branches, no pathways.
Right. The person is closed. Yes. Windows are also not open, so not very much open. Self-esteem is less, and this is again from the letter only. Okay. So few drawbacks of this technique of this test are projective tests are most frequently used in therapeutic settings. Okay, as like Sanika is sharing. No, okay. I'm just saying that these projective tests are most frequently used in therapeutic settings where therapy needs to be there, fine. Right. So in many cases, therapists use this test to learn qualitative information about the individual. Some therapists may use projective test as a sort of icebreaker to encourage people to discuss issues or examine their thoughts and emotions. So like while projective tests have some benefits, they also have a number of weaknesses and limitations. So which includes projective tests that do not have a standard grading system tend to lack both validity and reliability. Scoring projective test is highly subjective. So interpretation of answers can vary dramatically from one examiner to the other. The respondent's answer can be heavily influenced by the examiner's attitude or the test setting as well. Yeah, so these are a few drawbacks. Okay.